The year is 2019. James, a senior in a Philadelphia high school, is out with a couple of his friends. They are hungry, so the group decides to get something to eat. Someone suggests to go to a nearby diner. It is cheap and tasty as well, so they agree. The group is having fun when halfway into the meal, James takes a bite, stops talking, and starts to wave his hands frantically. His friends notice that he was choking. Luckily, the waiter, who is trained for such emergencies, performs the Heimlich maneuver and saves James's life. The next morning, James isn't feeling so well. He complained to his mother about his symptoms, which were dizziness, sore throat, dysphagia, which comes from the Greek word dys for difficulty and phagia to feed, the difficulty to feed or the difficulty in swallowing, and on top of that, a feeling of a foreign object in his throat. So James is presented to the emergency room. After telling the attending emergency physician his story about last night's choking incident, he expresses concern that a part of the chicken bone might be stuck in his throat due to the incident, and that is what's causing his symptoms. The attending emergency physician orders a soft tissue neck radiograph, which is commonly requested in the emergency department either to look for foreign bodies or particularly to assess a retropharyngeal abscess or upper airways infection. The radiograph revealed a 4.6 centimeter linear object in the vallecula, which is the part between the root of the tongue and the falls in the throat. The radiograph department read the foreign object as a chicken bone. So the otolaryngology team was consulted and thereafter performed a nasopharyngeal laryngoscopy, which did not reveal a foreign body in the upper aerodigestive tract. On physical examination, the physician noticed that the right tonsil was tended to palpation. Upon further review of the radiograph, the right styloid ligament was noted to be elongated and calcified. A CT scan was performed, and thereafter the diagnosis was Eagle syndrome. First described by American Watt Wilms Eagle in 1937, the Eagle syndrome is a condition which is caused by an elongated or misshapen styloid process or calcification of the styloid ligament, either of which interferes with the functioning of neighboring regions in the body, giving rise to pain. Approximately 4% of the general population have an elongated styloid process, and of these about 4% give rise to the symptoms of Eagle syndrome. Therefore, the incidence of styloid syndrome may be about 0.16%. Common symptoms are sharp shooting pain in the jaw, the throat, the base of the tongue, the ears, the neck or face, difficulty swallowing, which might have caused the choking in the first place, the sensation of having a foreign object in the back of the throat, pain from chewing and swallowing, pain while turning the neck or buzzing in the ears, also known as tinnitus. While these symptoms might affect the quality of someone's life, they are not life-threatening. But wait, there is a chance this disease might become life-threatening after all, in which is called vascular Eagle syndrome. In this instance, the elongated styloid process comes in contact with the internal carotid artery below the skull. Turning the head can cause compression of the artery or a tear inside the blood vessel, which restricts blood flow and can potentially lead to a transient ischemic attack, also called mini-stroke. Because of the proximity of several large vascular structures in this area, this procedure should not be considered risk-free. But luckily for James, the operation was a success, and he was able to make a full recovery. Today, although there are many theories on what might cause this phenomenon, the real cause of Eagle syndrome is still unknown.